Good day, nurses. Welcome to our review. Let us answer 20 questions. So let's start. Question number 1. In basic fundamental of nursing, what are the 4 main vital signs? A. BP, respiration, pulse, oxygen saturation. B. BP, respiration, temperature and pulse. C. BP, respiration, oxygen saturation and pulse. And letter D. BP, respiration, oxygen saturation and temperature. What is the answer? Letter B. BP, respiration, temperature and pulse. Question number 2. The term pyrexia is A. Normal body temperature. B. Temperature is above normal. C. Temperature is below normal. And letter D. All of the above. What is the correct answer? Letter B. Temperature is above normal. Question number 3. In taking temperature, what is the most accurate and useful method to measure body temperature? A. Oral. B. Axillary. C. Temporal. And letter D. Rectal. What is the answer? Letter D. Rectal. Question number 4. You identified tachycardic patient with a heart rate of A. 80 beats per minute. B. 90 beats per minute. Letter C. Under 100 beats per minute. And letter D. Over 100 beats per minute. What is the correct answer? Letter D. Over 100 beats per minute. Question number 5. You identified apnea patient with a respiratory rate of A. 12 to 20, B. 16 to 25, C. 60 to 100, and letter D. Over 100. What is the correct answer? Letter A. 12 to 20. Question number 6. What does the pulse indicate? A. Oxygen supply. B. Breathing. C. Pressure in the arteries. And letter D. Heartbeat. What is the answer? Letter C. Pressure in the arteries. Question number 7. What is the term for slow breathing? A. Apnea. B. Tachypnea. C. Bradycardia. And letter D. Bradypnea. What is the correct answer? Letter D. Bradypnea. Question number 8. When taking respiratory rate of patients, do all the except A. Tell the patients to count. B. Count for 1 full minute. C. Watch the rise and fall of the chest. And letter D. Records after counting. What is the correct answer? Letter A. Tell the patients to count. Number 9. Pulse site at the neck part is called A. Temporal, B. Carotid, C. Brachial, and letter D. Femoral. What is the correct answer? Letter B. Carotid. Number 10. You assess a pulse of 30 for 15 seconds. What is the total pulse rate for 1 full minute? A. 70, B. 60, letter C. 50, and letter D. 65. What is the correct answer? Letter B. 60. Number 11. A term febrile will exhibit an A. Temperature of 38 degrees Celsius, B. A pulse rate of 60 beats per minute, C. A normal temperature of 37.5 Celsius, and letter D. A respiratory rate of 16 beats per minute. What is the correct answer? Letter A. A temperature of 38 degrees Celsius. Number 12. Which of the following is not the responsibility of a nursing assistant? A. Helping residents bathe. B. Administering medication. C. Applying ice compress. And letter D. Assisting in ambulation. What is the correct answer? Letter B. Administering medication. Next question. In infection control, what is the best way and cost-effective to prevent infection? A. Application of antiseptic hand rub before and after patient's contact. B. Practice standard precautions when caring for patient. C. Wear gloves when in contact with body fluids. And letter D. Frequent hand washing. What is the answer? Letter D. Frequent hand washing. Next question. Term dyspnea refers to A. Difficulty defecating. B. Difficulty breathing. C. Difficulty swallowing. And letter D. Difficulty urinating. What is the answer? Letter B. Difficulty breathing. Number 14. What protective equipment should be worn when changing an incontinent patient? A. Mask and gown. B. N95 mask. C. Gloves and gown. And letter D. Gloves, gown, and mask. What is the correct answer? Letter C. Gloves and gown. Number 15. When giving care to a patient, the nursing assistant should avoid the unnecessary exposure of the client body in order to protect the client's right to A. Freedom of choice, B. Privacy, C. Confidentiality, and letter D. Refuse. What is the correct answer? Letter B. Privacy. Number 16. What is the most common side effect of medication? A. Salivation, B. Dyspnea, C. Diarrhea or constipation, and letter D. Tachycardia. What is the correct answer? Letter C. Diarrhea or constipation. Number 17. During your rounds, patient who is resting in bed suddenly complains of shortness of breath. What is your action? A. Raise the patient's feet. B. Instruct patients to take deep breath. Letter C. Elevate the head of bed at 90 degrees. And letter D. Monitor the resident's vital signs. What is the correct answer? Letter C. Elevate the head of bed at 90 degrees. Number 18. If a resident becomes confused, you should A. Let the patient sit alone to think. B. Place the resident in his or her room so the persons won't wander. C. Put the resident in restraint to prevent falls. And letter D. Help the residents recognize familiar items. What is the correct answer? Letter D. Help the resident recognize familiar items. Number 19. In an adult CPR, how many compression ventilation ratio without advanced airway? A. 30 is to 1. B. 30 is to 2. C. 15 is to 1. And letter D. 15 is to 2. What is the correct answer? Letters B. 30 is to 2. Number 20. In an infant CPR with 2 rescuer, how many compression ventilation ratio? A. 30 is to 1. B. 30 is to 2. C. 15 is to 1. And letter D. 15 is to 2. What is the correct answer? Letter D. 15 is to 2. Thank you guys for watching. Please subscribe.